So regarding aging of the face and neck, this photo is striking, but this is actually a truck driver, so you can see the effects that sun can have on the skin. So we use the term rhytids for wrinkles, but you also see epidermal thinning, you see loss of collagen throughout the skin. Elastosis is replacement of elastin fibers and disorganization of elastin fibers. And the skin dehydrates as well. We can actually measure that by measuring the amount of water that evaporates off the skin, and we see that this does decrease with age. Of course, as I said, this is accelerated by the big three. That's sun exposure, dehydration overall, and smoking greatly accelerates this. As far as aging of the deep face, so if you look at this patient here, you do see loss of mid-face volume. You start to see her underlying bony structure as this kind of slides off, and we see that she becomes more of a heavy face. If you look at these triangles, we like to say that the youthful face is an inverted triangle, whereas the aged face can be an upright triangle. Additionally, if you look closer at the eyes, you see this kind of, we call this a double convexity here, where we see some prolapse of the fat below the eye, and that's juxtaposed against this falling cheek. The upper lip does elongate with time, and these nasolabial folds do tend to deepen over the years. Now, these nasolabial folds, after a certain amount of time, will kind of connect into what we call marionette lines here. And then finally, what everyone hates is jowling. So we see jowling here, as well as what we call a pre-jowl sulcus right here. And then even more importantly, you can see in this is a young female on the left and an older female on the right. We actually get bony changes and bony remodeling over time as we age. As far as the neck, everyone knows about platysmal banding here. So we see these platysmal bands frequently on both males and females. Additionally, what's a little more subtle, you can see descent of the submandibular or spit glands here. These do descend with time, and if you get a facelift or a neck lift that doesn't address this, it can be a real problem postoperatively. And then finally, centrally here, you see what this is called subplatysmal fat, just meaning that it's fat that collects underneath these platysma muscles. And again, if this is not addressed concurrently while you're trying to fix these platysmal muscles, you can have a serious problem postoperatively.